I'm often asked about our training program and how it began, how it came to be. In reality, this program was founded in order to respond to a need by licensed acupuncturists, students of Chinese medicine, and a number of Western medical doctors who had come into contact with this incredible system of medicine, five-element acupuncture, and were eager not only to learn more about it, but actually to study it, to make it their own practice. However, there were, and in fact still are, few options available in this country to properly be trained in it. What tended to happen when people in the field of medicine first learn about five-element acupuncture, whether hearing about it from a colleague, taking a workshop in it, or receiving personal treatment as patients, is that they're taken by its scope, by its depth, by its relevance to the medical needs of our time. Its efficacy, how well patients tend to respond to it, and also by witnessing or experiencing firsthand the unique quality of interaction between the patient and practitioner that is possible in this system of medicine. They see how through this approach a patient is truly viewed and treated as a unity of body, mind, and spirit in actual practice, in every treatment. They've noticed that rather than attending to the symptoms or the ravages of illness, the practitioners of this system is entirely focused on helping the patient regain their natural balance and equilibrium. The same balance and equilibrium that, when lost, contributed to the illness in the first place and continue to interfere with the process of recovery to health. If their background or training is in Western medicine, they appreciate the vast difference in the orientation of the two approaches. In one, the primary focus is on the fundamental balance of body, mind, spirit of the patient, and in the other, the attention is on the disease and its symptoms. In one, the treatments are chosen to support the patient's natural capacity to recover and heal, and in the other, the treatments, whether pharmaceutical or surgical, are chosen to address or match the disease and the symptom. If they are acupuncturists of other traditions, sometimes referred to as TCM practitioners, they notice the fundamental difference between the two methods in relating to the patient's energy or qi. In five-element, the energetic imbalances are assessed at their deepest elemental level rather than focusing on various syndromes or conditions that are the manifestation or outcome of an elemental energetic imbalance. Also, what may stand out about this system for a TCM practitioner is the exquisite attention paid to the state of mind and the well-being of the patient's spirit, with the knowledge to actually diagnose and treat those deeper levels. Some years ago, here in San Francisco Bay Area, a group of such practitioners, some already licensed acupuncturists, some MDs, they formed a group and approached me to ask if I would teach them. I agreed, and this training program was born. At the outset, it was clear that the program needed to fit the special needs of these working professionals, that is, allow them to maintain their practice while they were studying, and at the same time to ensure that the quality of the teaching was not compromised and that the system of medicine was taught in its entirety. In fact, The overarching goal from the beginning was to ensure that the students, at the time of graduation, had not only acquired the complete knowledge and skills of a practitioner, but have embodied the spirit of this medicine. So I agreed to run a pilot project with this first group to determine what would work. We met for 5 days straight to begin the program, and then followed up with 1 3-day weekend every month, with of course homework and exercises to be done at home in between. He agreed to continue meeting me once a month, study diligently, and here was the key: to allow me to determine when I thought that they were ready to be graduated from the program. It took that first group actually 3 years before I felt that they were ready. Of course, subsequently, we were able to refine the programs so that we were able to achieve the same results in 2 years. And many years later, I still feel that the 2 years is the minimum time to ensure that the material is not only passed to the students, but it has been sufficient. There has been sufficient time to make sure that it has been integrated and embodied by the students. This year, 2016, makes the 25th year of our program. Over the years, many licensed acupuncturists, students of acupuncture, MDs, have gone through this program and are practicing this system of medicine at various places around the state and country. Some of them have chosen to remain with their graduating class and meet with me twice a year, not only to continue developing their skills and their understanding of this medicine, but to continue cultivating what we consider the most cherished qualities of a practitioner, which is how to remain open and present in the treatment room. Over time, these continuing education classes have formed a community of practitioner graduates that share an appreciation of a system of medicine that values treating each patient with a special quality of insight and tenderness, holding each patient as a unique being, each with their own particular needs, a system that strives to treat the patient who has the illness rather than the illness that the patient has.